Guild's history began in the 1970s when the Hastings State Hospital closed. Hastings State Hospital, which opened in 1900, was the second original state mental health hospital in Minnesota. When it closed, long-term residents with serious mental illness had nowhere to go. That's when the Guild of Catholic Women stepped in. The Guild of Catholic Women was a volunteer organization founded by local Catholic women in 1906 to serve the local community. In the 60s, they had a boarding house known as the Guild Hall, which housed young Catholic women working in the cities. In the 70s, Guild Hall became empty. When Hastings State Hospital closed, the Guild of Catholic Women took in 86 patients from the hospital and housed them in Guild Hall. They began hiring mental health professionals to provide services. In the 80s, the Guild of Catholic Women opened another residential mental health facility in South St. Paul, which is now known as Guild South. In 1990, to better serve the clients of Guild Hall and Guild South, the Guild of Catholic Women established Guild Incorporated, a Minnesota nonprofit. In the 90s, Guild implemented a housing-first approach to our services. We started providing supportive housing services to help individuals with a serious mental illness live independently with supports. This approach was successful, and we later closed Guild Hall and moved all residents into their own independent living situations. The Community Support Program Member Center, also known as the CSP, opened in 1994, providing a space for clients to interact, attend groups and classes, and get help with socialization and living topics. Around this time, our employment services were launched to help individuals find jobs and offer support along the way. In 2003, Guild formed Delancey Services and began providing housing services to individuals experiencing chronic homelessness. In 2005, Guild expanded services to offer adults with a serious mental illness a comprehensive and community-based service model called Assertive Community Treatment, or ACT. In 2009, Guild partnered with Project for Pride in Living to create Delancey Apartments, a 13-unit apartment building with supportive housing for people with a history of chronic homelessness. In 2014, Guild expanded ACT services to youth ages 16 through 21 years old to address a study that identified a lack of supportive services for young people, which led to longer than necessary psychiatric hospital stays. In 2016, Guild became one of the first agencies certified to provide behavioral health home services. In 2018, Guild Incorporated started the process of rebranding to increase community awareness and update our presence. In 2020, we completed this rebrand and went from Guild Incorporated to Guild. We updated our colors and logo and got a whole new website. You will likely notice that our social media accounts, website, and email are Guild services, but just refer to us as Guild. Since the website and social media accounts for the name Guild were taken, we tacked on services to our name, but our official name is Guild. In 2020, we also opened a brand new facility in the Southwest Metro known as Guild Crisis and Recovery Center, Scott County. It's the first residential mental health facility to be opened in the area. Now, Guild has several different locations. Our main office is at Guild Wabasha in St. Paul, Guild Crisis and Recovery Center in Savage, intensive residential treatment services and crisis facilities called Guild South and Marines House in South St. Paul, the Community Support Program Member Center, or CSP, a community space for clients to socialize in West St. Paul, and the Delancey Apartments in St. Paul. Today, Guild serves as a Minnesota nonprofit organization that offers mental health, housing, and job-related services to individuals living with a mental illness or experiencing chronic homelessness. On any given day, we serve 900 individuals across the metro area. Our purpose is empowering change through engaging individuals and communities, embracing needs, and elevating voices. Our values are empowerment, dignity, collaboration, innovation, and perseverance. That means our goal is to empower people to discover their own potential by giving them the steps they need and helping them along the way. We also strive to build more equitable systems to improve our community. We currently have over 20 programs. These programs fit into three main categories: health, housing, and jobs. Our services are divided into 3 service lines. Integrated services include housing and employment services. Community treatment services include community mental health services and the CSP Member Center. And residential treatment services and coordinated health include our residential service centers and coordinated health services. Our mental health services include case management, residential treatment centers, community support services, coordinated health services, and community mental health treatment services. Our housing services include homeless outreach, housing support services, a 13-unit permanent supportive housing apartment complex called Delancey Apartments, and services to connect individuals experiencing homelessness with housing. We have both adult employment services and youth employment and education services. You can find information on each individual program on our website at guildservices.org. Thanks for taking the time to learn more about Guild.